Natural Health Tricks 24/7, brings health to patients, restore health holistically. End-stage renal disease. End-stage renal disease, ESRD, or end-stage kidney disease, occurs when chronic kidney disease, the gradual loss of kidney function, reaches a progressive state. The kidneys of people with ESRD, kidney function less than 10% of their normal capacity. Your kidneys no longer function normally to meet the body's needs. When your kidneys lose their ability to filter, levels of fluids, electrolytes, and dangerous wastes can build up in your body. For end-stage renal disease, you need dialysis or a kidney transplant to survive. But you can also choose to give up dialysis or transplant and choose conservative care to control your symptoms. Causes of end-stage renal disease. End-stage renal disease occurs when the condition decreases kidney function, causing kidney damage to worsen for several months or years. Diseases and conditions that lead to end-stage kidney disease include: diabetes is the leading cause of end-stage kidney disease. Kidney disease is result from type 1 or type 2 diabetes. With either type, poor control of blood sugar increases the risk of end-stage renal disease. High blood pressure. Glomerulonephritis, inflammation of the kidney's filtration units, glomeruli. Recurrent kidney infection, pyelonephritis. Polycystic kidney disease. Interstitial nephritis, tubular inflammation and surrounding structures. Prolonged obstruction of the urinary tract, from conditions such as enlarged prostate gland, kidney stones and some cancers. Vesicoureteral vesicures, a condition in which urine flows back into your kidneys. Exposure to toxic drugs, such as certain antibiotics, pain relievers, chemotherapy, contrast dyes. Signs and symptoms of end-stage renal disease. Early in chronic kidney disease, you may have no signs or symptoms. But when chronic kidney disease progresses to end-stage renal disease, signs and symptoms include high blood pressure, hypertension, that's difficult to control. Changes in how much you urinate. Fatigue and weakness. Nausea and vomiting. Loss of appetite. Shortness of breath, if fluid builds up in the lungs. Sleep problems. Decreased mental sharpness. Muscle twitches and cramps. Swelling of feet and ankles. Persistent itching. Chest pain, if fluid builds up around the lining of the heart. In particular, signs and symptoms of kidney disease are often nonspecific, meaning they can also be caused by other illnesses. Because your kidneys are highly adaptable and able to compensate for lost function. State of emergency. So, signs and symptoms may not appear until irreversible damage has occurred. Symptoms may remain mild or absent until kidney function drops to less than 20% of normal. In particular, dialysis is urgent when one or more of the following occurs: fluid overload or congestive heart failure, CHF, that cannot be managed with medications. In CHF, fluid backs up into the lungs, legs and other parts of the body. Dangerous elevations of potassium, sodium or acids in the blood. These substances can affect how other organs function. Confusion, decreased alertness or seizures. Bleeding related to kidney failure that cannot be improved through other means. Inflammation of the covering of the heart. Severe, unrelenting nausea and vomiting. Also, dialysis also be necessary when symptoms affect quality of life or nutritional status. This is especially true when they are accompanied by severely abnormal blood tests. Solution for Kidney Disease is a natural step-by-step program that teaches you how to reverse kidney disease even if you are end-stage renal disease. On top of that, the program allows you try it for free for 2 months. Link in the description. Thank for watching. Good health. Visit website now.